Yeah. So thanks for the introduction. I myself am Dr. Meganath. I work in Care Hospitals, VIZAG. So this is the first time I am speaking to a forum like clinical pharmacists. Okay. Of late, we have got some few clinical pharmacists in our hospital also. So before coming to this, like I have gone through some research about what clinical pharmacy is and PharmD is, and I have gone through your syllabus, your curriculum for 6 years curriculum, and the topics extensively which cover pharmacology. And I should say it's really a tough thing because we have just one subject of pharmacology in our third year, where we nearby, you feel this smell, you can a headache may be aggravated. Maybe particularly if you drink something cold or eat something cold and aggravate, maybe headache may be aggravated. So basically, there are different reasons why headache comes. Headache doesn't come simply without any reason out of the blue. So there may be a stress reasons, or there can be hormonal reasons, especially in girls, as, during menstruations or using some OC pills. They're having the intensity of headache. So all these are the causes of headache. I can't say the causes of headache, but they are the types of headache. And this is typically what a migraine is. Migraine occurs when there is a particular triggering factor. So normally, the normal individuals for these small triggers, they may not be sensitive for developing a headache. People who have migraine, they are highly prone because of mechanism in the brain why they develop headache. So regarding how to avoid these triggers and lifestyle modifications, what are required, I'll deal in the end. Now, basically, if you take headache or migraine, it is classified into three types: migraine with aura, we say; without aura, we say; and something called complicated migraine. Now, with aura, so those of you who had this typical migraine headaches, I think in the audience, at least there would be 5 or 6 people who have experienced migraine headache, especially females. So the headache, before commencement of the headache, you will be feeling some symptoms that the headache is going to come. We call it as the warning signs. So these are different types. It can be some sensitive, sensory symptoms or motor symptoms. Sensory symptoms, matlab, you can be having like flickers of light floating in front of your eyes. There may be some colored halos rotating in front of your eyes, or you might be having some unusual smells. And there is typical excessive yawning. So excessive yawning is also sometimes a sign of headache, or if having some visual disturbances. You can say typical scotomas. They're having insensitivity to light. They can't tolerate light. They can't tolerate sound if someone is speaking at them. Even the minor sounds they can't tolerate. We call it as phonophobia. There will be photophobia, which is insensitive to light, and they will be having this visual disturbances like scotomas, we say. So blind spots. So part of the vision will be totally obscured, and nothing to be worried. All these are temporary, and they last within 25 minutes, max within 60 minutes. So no aura doesn't last beyond 60 minutes. So this is migraine with aura. Migraine without aura is simply headache without all these symptoms. So that is also a migraine. You need not have all these features, and then you will have something called as complicated migraines. Complicated migraines are they present as headaches, but they also have some other features, like
Yes, sir.
you have some weakness of the limbs and speaking troubles, speaking difficulties, which we call dysphasias. But they are all temporary. It's not like a routine stroke or CVA where this is permanent. So these are various stages of migraine with aura. So why does this migraine occur? Because we should always know the pathophysiology, so that we can the apt pharmacology or the drug can be prescribed. Now, migraine occurs basically because of vasodilatation. So headaches always occur because of vasodilatation, and most of the drugs which we employ for treating migraine headache are vasoconstrictors. But the aura occurs because of vasoconstriction. So typically in a patient with migraine with aura, initially there will be cerebral vasoconstriction in the brain. So to compensate that, you all know that there is this beautiful mechanism in the body. There are always compensatory mechanisms in all the vital organs of the body. Brain has a compensatory mechanism, heart has compensatory mechanisms, kidneys has a compensatory mechanism. So whenever there is vasoconstriction, which reduces blood flow to the brain, to compensate that, there will be vasodilation of the brain vessels and the vessels in the neck, extracranial part, that is vessels in the neck. So that is why, if you have experienced a migraine headache, the headache will be usually call it as a pounding pulsatile headache. You feel like pulsation on your brain and and around the back of the neck. So that because of this cerebral vasodilatation and extracranial vasodilatation, you will be having a pulsatile pounding headache. So most of the drugs which we use for treating migraine are vasoconstrictors. So what the next part? And typically a migraine headache will be unilateral headache. So the headache will be only on one side of the hemicranium of the skull and with associated nausea or vomitings. Usually there will be nausea or vomitings. There will be phonophobia, photophobia. Most importantly is it will debilitate, allow you to work, or when you work, the headache intensity increase. But remember that not all headaches are migraine headaches. So don't come to conclusions that all headaches are migraine headaches. There are these should be there and aura will be there. There are some other headaches. Say if you think you have sinusitis, the sinus headache is different because the sinus headache will always be around the sinuses in front of the brain. So you have the sinuses here like a fly. So the sinus headaches will be concentrated on the sinus parts. And then you have something called as tension type headache. Usually, tension type headache occurs at the end of the day because after you work out throughout the day, you are stressed out. You have this tension type headache, which is the bitemporal headache, which usually happens in the end part of the forehead. We call it as like a band headache. It's like a tight band which is constricting around your head. So that is a tension type headache. And you have something called cluster headache. Cluster headaches usually the pain is very severe behind the eyeballs with associated tears from the eyes and nasal stuffiness and all. So typically there are characteristic headaches, and someone who is having because headache because of hypertension, if the blood pressure is high, the headache will be in the back part, the occipital part of the vertex part. So these are
Yes,
so,
sir.
yeah. So don't consider all headaches are migraine headaches. Migraine headache will typically be unilateral, one half of the face or one half of the head, and all will be on the same affected side. So if it is right side, in the right half of the body, you will have prickling and numbness and all these sensations. And migraine is usually disease of the elderly. So around above 40, 45, it is very unusual. But if someone has very severe headache above 50 years of age, then definitely you have to look for other signs or other causes. We call it as the red flags. So if someone is having headache with fever or headache with fits or seizures, because seizures usually occur in migraine. So there are red flags where you have to see other causes. Now, um, coming to the treatment part, how to handle it. Now, treatment is always evidence based. You have a level of recommendations and level of evidence always for any drug which is prescribed for any disease. Now, coming to the treatment part of migraine, there are only two drugs which have level A recommendation with strong evidence. That is, one is NS and the second one is triptans, which we call as 5-HT1 agonists. Now, NSAIDs, there are a lot of NSAIDs in the market. So the most common used for treating migraine is one is the naproxen sodium, second one is acetaminophen or the paracetamol. Aspirin we don't use in India because 300 to 325 mg of aspirin will cause gastritis or it may cause bleeding and all this. So we don't use aspirin. We use only paracetamol, or it can be naproxen sodium or simple combiflam or indomethacin, all these combinations. So only these three drugs, and these should be used only for acute attacks when the attack is very severe. And as much as possible, the usage of these drugs should be reduced. And second important class of drug which we use to treat migraine is the triptans, which you call as the 5-HT1 agonists. Now, triptans, there are various triptans. You have sumatriptan, you have zolmitriptan, you have rizotriptan, you have provitriptan, which are available in India. Of these, we commonly use is sumatriptan and rizotriptan and zolmitriptan. Provitriptan, we exclusively use it only for migraines in pregnant patients. And rest of the things, and we use, and these are all available in tablet forms, or they're available in orally disintegrating forms. They're available in nasal spray. They're available in subcutaneous injections. So in various formulations, and of course the cost is higher. And most importantly, the usage of triptan should be like before the initiation of headache. So the moment you come to know that your headache is going to start, or there are some premonitory or warning signs, these triptan should be taken either in the form of oral disintegrating tablet or in the form of a nasal spray. Because once the headache reaches its intensity or peak intensity, these drugs are not going to work. And we have to be very careful in using these triptans. You can't use it like more than 2 or 3 times in a week, because there is something called tachyphylaxis. You might all be knowing what is tachyphylaxis of drugs, because the same amount of drug which is given continuously, it stops working. So it stops working for the patient. So most of the centrally acting drugs which act on the nervous system have this tendency of tachyphylaxis. So they shouldn't be used indiscriminately. And most importantly, for treatment of migraine, the important part is the education of the patient. You have to sit with the patient, discuss with him, make him realize, yeah, make him realize that this is not going to end, or this is not, there is isn't a complete cure. So it mostly depends upon how he modulates his life and how he is going to make some changes. And always make sure that the usage of analgesics or these kind of drugs is minimum. So there are also other classes of drugs which are used. We use anti-epileptics like valproate or topiramate. We use antidepressants, the tricyclic antidepressants like amitriptyline or nortriptyline, or SSRIs. Sometimes we also use SSRIs, and antihypertensives like beta blockers, and also use calcium channel blockers. Most commonly we use propranolol beta blocker, and metoprolol also is used sometimes, and calcium channel blockers like nimodipine are also used. And we also have something called serotonin antagonists. One is the flunarizine, the Siberian, which is prophylaxis or maintenance, and most of the NSAIDs. Now, like anything, because this is mostly a lifestyle disease, you have also some non-pharmacological therapies like CBT, cognitive therapies, some relaxation techniques, and all this. And coming to the final part, how to prevent this and what are the lifestyle changes we need to make. Now, there are some common food items which can precipitate or act as triggers for migraine headache. As I said, one is coffee. The intake of coffee should be limited or moderated. Ideally, 1 cup of coffee, not more than that. If you are too addicted and if you stop for a few days, you will always have a caffeine withdrawal headache. And it's also common in people who take a lot of chocolates or who take a lot of aged cheese, very old cheese, because these contain tyramine in it. This tyramine is a neuroactive substance, so it can precipitate cerebral vasodilatation. And some processed meats, especially tinned foods. If you take processed meats, tinned foods, and most of the packed foods always have this artificial sweeteners. So we know sweeteners like aspartame, you can have monosodium glutamate, or you have something sucralose. So all these are artificial sweeteners. Nowadays you got these sugar-free pills which contain this artificial sweetness. So most of them contain histamine. So histamine, again, we know it is involved in the anaphylaxis reactions. So it can also cause headache. And taking red wine or something causes hangover headache the next day is mainly because of histamine. That is, for most of the patients who have this hangover headache, we advise a simple antihistaminic the day before, or 2 to 3 hours before consuming alcohol. So finally, there is something called headache hygiene, which we all need to follow. One important thing is the regular sleep pattern. So you have to sleep, go to bed, and wake up from the bed at the same time. Try to maintain a sleep cycle, and too much of sleep and too little of sleep are also not helpful, useful to the body. And sometimes we have this habit of taking small power naps. We just nap, get out, get a 10 minutes. You just feel like relaxed. But you might have observed when you have take those small naps, immediately after getting up, you will have this headache. So too little or too much of sleeping is also not advised. And of course, exercising regularly, at least 15 to 20 minutes in per day, at least for 3 weeks in a day. And most importantly, don't skip your meals. And the major meal of the day should be breakfast, and always try to reduce stress. So finally, have a healthy lifestyle. You should avoid stress. You should have good sleep and always have balanced diet. Yeah.
Yes, sir. So, sir, like you said, we can't use aspirin in India like other countries use, but in market there is availability of aspirin mouth dissolvable tablet, no, sir. How,
Yeah.
sir, then can you use
Yeah.
that in this way, sir?
No, no. Aspirin, we have 150 mg, 325 mg dispersible tablets. We use it only for angina. So when there is acute angina or acute coronary syndromes, we say we give it as a loading dose along with clopidogrel 300 mg. So that is the only indication we use it, because now there are suitable and better alternatives and NSAIDs which are available. We stop discontinue using the usage of, because as you know, all NSAIDs, they inhibit clotting mechanism, so they have this tendency to cause bleeding and all this, and they also have very severe gastritis and peptic ulcer bleeds. So we are now using 325 mg aspirin only for acute angina or chest pain.
Sir, please tell your view on this COVID-19 condition, sir.
Yeah.
Just
Yeah. See, COVID-19, we have seen many pandemics, many epidemics previously all over the world, and even in our country, we have cholera, plague, whatever we have. But what is the striking difference between most of these pandemics and this pandemic is the asymptomatic transmission. Now, the asymptomatic transmission is the biggest challenge, because if you say you take Nipah virus, you take Ebola virus, whatever it is, they're even more deadly. The mortality rate is as high as 40 to 50%. People who have Ebola, they die. It's very catastrophic. But why this is more dangerous is, as I said, because of asymptomatic transmission. See, only if you have symptoms, only the government authorities can identify or a doctor can identify and you can be isolated. But if you don't have symptoms, it's very difficult to identify you, isolate you, or to track you. So that is the biggest challenge. And in this process of asymptomatic transmission, on an average, if one is suspected to be COVID positive, asymptomatically he might have transmitted to at least 100 patients in a matter of 1 week. So that is the biggest challenge, asymptomatic transmission. Or else, if you see, in India, it is quite positive and quite bright, especially because of the demographic characteristics of India. Now, if you take India, the average age of Indian population is 24 years. You'll be surprised. 24 years is the average age. So we have a lot of middle-aged young population in India. That's if you see the mortality is very low. If you see all over India, the mortality is just 3% compared to other countries where 6, 8, and even 10% like Italy and UK. So overall, 90% of them are minor symptoms. They're recovering spontaneously. But thing is, public should behave more responsibly, because we may have good immunity, we may be middle-aged, and we may recover well. But if we spread it to others, elderly, we may be the reason or responsible for someone else's mortality.
yeah, sir. So we have few questions from our followers or students, sir. I would
Yeah.
like to ask you. So the first question is, so how far our Indian hospitals or our Indian medical system encourage families as clinical pharmacists, though it is a private sector or government sector?
Yeah.
How do you think, sir?
Yeah. See, now any specialty, the identification should first come from the government. Okay, so the identification and recognition should first from the government. Now, basically, before coming to your talk, for the last 2 3 days, I have done research like what is a clinical pharmacist and what they're supposed to do and what they're doing in other countries. Now, see, the role of a clinical pharmacist is actually mostly taken by the clinicians themselves most of the times, or most surprisingly, it is taken by some apps which are available. Okay, so I would tell you an example. Say I have a patient who has renal failure. I want to dose modification of a drug. So ideally, this should be done by a clinical pharmacist in the institution or in the hospital. But what we do now have an app where we take the MDRD formula, calculate the dose, and give the dose.
Yes, sir.
Yeah. And for example, say there are some other things. A patient walks into my clinic. So most of the times, see, whenever a patient walks into my clinic, whenever any drug is prescribed, you have to take into consideration his previous drug history, his previous drug allergies, any anaphylaxis, what other concomitant drugs he is using, what would be the various associations between drugs, and all these things should be taken into account, which we most often don't do. Or either some physicians do themselves or some physicians don't do at all. Now, this is where the role of clinical pharmacist is very important. And I think clinical pharmacist is not someone who sits in the pharmacy. He should be part of the clinical audit. He should be part of the treatment protocols, and he should be involved everywhere. Now, I tell you another example. You have a lot of gynecologists and obstetricians. They are seeing a lot of pregnant women. We know most of the drugs, they have quite strict contraindications in pregnancy and even in lactation. Okay, so many antibiotics, so many things. You have this typical thalidomide example where this feel like so many patients have. So after that, other countries have started advocating the use of clinical pharmacy. Yeah, unfortunately, we haven't used. So I think we have much bigger role, especially in pharmacology. I mean, in gynec obstetrics, because most of these drug interactions, contraindications are there. You have a major role in nephrology because the dose modification is always required. Um, and second, you have an important role in oncology because again, the dosage is based on the body surface area, and there will be many lot of drug interactions in that. An important role in psychiatry or most of the medicines, the opioids, whatever it is, the analgesics which we use, all those spirits and all those things which we use. So you have a lot of opportunities in this. And see, most often we talk about rational medical use, rational use of drugs. We talk about antibiotic stewardship. We talk about antibiotic resistance. So all this actually we have taken the mantle as clinicians on our heads. But I think ideally this is where the clinical pharmacists come, and this is the role of clinical pharmacists. Where
Nowadays, we are seeing antibiotic resistance for most of the patients. Where even my nephew, who was recently hit with the typhoid, and we took him to a general physician. That sir directly recommended imipenem to him, and he was only 13 years of age.
Okay.
So imipenem is higher antibiotic for his age, right?
Which antibiotic?
Imipenem, sir.
Imipenem. Okay. No. That's imipenem giving in an outpatient basis or in an inpatient basis. Right away, we don't know. That's why we always have this antibiotic step-ladder escalation policy. So we have to go according to that policy only. And I can say, see, based on your profile, because PharmD, you are ultimately doctors of pharmacy. So name itself, you are doctors. So what I can suggest you people in the next few years, coming years, is you can start something called a community clinical pharmacist or something, because you have most of the shops. You always so they just take clinical symptoms, whatever the patient is suffering, and then prescribe your medicine. Now you can bring a change in that. Now, being a community clinical pharmacist, you can start your small. I can't say clinics, or but you can start prescribing and documenting, taking into history. Yeah, it's not first aid. I can see, because see, there will be different kinds of medicines. You always know one is prescription only medicines, and you always have this OTC drugs. Now, OTC drug, it's not a problem. You can prescribe to anyone. Okay, but the problem is you have to be more careful with the OTC drug than giving a prescription drug, because a prescription drug is always given by the clinician taking into consideration all his health conditions. But if you see the OTC drugs which is now happening in the society, there is indiscriminate use of OTC drugs, indiscriminate use of anesthetics, indiscriminate use of steroids everywhere. So you people can make that change. Now, if someone comes to you, talk to him what his ideal clinical condition is, what he is suffering from. You can just check his BP or temperature and you can give him the right medicine. So ultimately, you can be part of the community, and minor elements, most of the minor elements you can treat. So because still, 60% of the pharmaceutical market in India is by the OTC market. It's over the prescription drive the 60% of the market. So that is where you can make the change. Just felt like you people can start being in some good pharmacy chains, talk to people, take history and give it. So ultimately, even for OTC drugs, people will start coming to you and start consulting you.
Sir, one more question, sir. What's your experience in treating this COVID-19 patient? Have you gone through any of the cases?
Yeah. So we have 2 units in VIZAG. So one unit, we have exclusively COVID patients there. Yeah, we are treating with COVID patients. As I said, now it's always important for any disease, not only for COVID or whatever disease, the patient coming at the right time and doing the right intervention is very important. Now, what happens most of the times is the patients just delay or start using some medications till the last minute, and this is all happens. And as I have said earlier, the statistics which I have shared, it's even the same in our hospital, because the mortality is high only in people who are above 65 years with multiple other illnesses, but most of the young are recovering and going happily.
Sir, final question: how your suggestion on dealing with infectious diseases spread and preventive measures that one should follow throughout his lifetime?
Yeah. So infectious diseases, now if you see in India, we have this triple burden. On one side, we have non-communicable diseases like diabetes, everything growing up in the country. On the other side, you have this infectious disease, malaria, dengue, still prevalent in the country. And on the other side, you also have this trauma accidents. So everything is a big burden in the country. And one important aspect for infectious diseases which are very high in the country. Of course, the incidence is drastically coming down in the last 4, 5 years or 6 years, if you see, because the socio-economic conditions or our living conditions are very important. Now, if you take, say, for malaria, dengue, it's always, we know it is spread by a mosquito. So most often we know we have mosquito breeding places around the house, and we know we should always consume boiled water, and we shouldn't get wet or drenched in the rains. And whenever we go into the rains, come inside, immediately wipe our head with a dry cloth, or always wash our clothes with Dettol or something. Okay, and we should use unnecessary medicines, because dengue is a disease where the platelet count drastically falls without expectations. So, and we have to be cautious, especially using NSAIDs or aspirin, all these drugs. And but most of the infectious diseases now, especially the commonly which we see, malaria, dengue, typhoid, leptospira, or whatever it is, most of the diseases we have now got very good disease treatment protocols, and most of them are recovering well. But as I said again, the timing and the approach to a doctor is always very important. Now, you can't self-medicate, especially in these diseases. You can wait for 1 or 2 days, but not more than that. But whenever you feel sick, it's always better to consult. Prevention sake, this is what I have said. Especially in monsoons, don't eat much outside. And as I said, don't drench in the rain. And if you take dengue, dengue is typically a daytime mosquito. Malaria is a nighttime mosquito. Okay, so malaria mosquito bites predominantly at night, dengue mosquito bites predominantly at the daytime. So daytime, most of us go to work. You can take simple precautions like always wear a full sleeves, don't wear half sleeves, full pants. And another important thing for dengue is the mosquito breeds in fresh water, fresh good water. It's not stagnant water like malaria. So we have this tendency, fill the buckets with water, keep it in the terrace or balcony. Some water gets pulled up in flower pots and all this. So make sure we don't have such kind of stagnation circles. And I think everything should.
Nice. Sir, now I request you to announce our comic posture results, sir.
Okay, 1 minute. It's from first or from the consolidation prices?
Yes, sir. We'll go from last to top, sir.
Okay.
From bottom.
Yeah. So the consolidation price, the first one is K. Salman Razu. He is second B Pharma from Maharaja College of Pharmacy. I think Vijayanagaram.
Yes, sir.
Yeah. Should I?
Yes, sir. Yes, sir. Please, sir.
The second from the consolidation price is Girwani. He is 6 Poundy from Sri Vidyaniketan College of Pharmacy. Okay.
Yes,
And he's from Dharani. He's for Dharani Putnuru. She's from Kakatiya Medical College. The second prize is for K. Bindu Vaishalya. She's 4th PharmD from Vignan College. And the first prize is gained by Chaitan, 5th PharmD from Jaimukhi College.
Yes, sir. Right. So I would like to congratulate all the participants on behalf of our CSSF team. And sir, please tell us something regarding Alzheimer's and dementia or these neurological disorders, which we made comic posture content is only regarding that concept.
Yeah. Now, see, dementia is nothing but it is always a degenerative disease. Okay. So the cause of dementia, the cause by Alzheimer's occurs is still a big suspense. Of late, we have identified some pathogenic structures like angiopathy, amyloid angiopathy, all this, why Alzheimer's is occurring. But again, this Alzheimer's and all these, I can say Alzheimer's disease or multiple sclerosis, these are all more of Western diseases. Like you can take, in India, we have more of Parkinsonism, we have more amyotrophic sclerosis and all this. And Alzheimer's dementia, again, for Alzheimer's, for most of the diseases which are coming out now, there is always